Welcome everybody to what are the homeopathic miasms. I'm really pleased to share this with you today. This is a massive passion of mine. It's a really huge part of my practice, as a lot of you know. And unfortunately, it's something that's really poorly understood and really not often written about. I have to say, a lot of people say to me, how do I find out more information about the web, about the miasms? How is it that I can learn more and get my head around it? And there's actually not a lot. And even at college back in almost 20 years ago, it was something that was very contentious around, even amongst homeopaths. So you may find that if you have had homeopathic treatment in the past, you may not have even heard about this. Or perhaps you're new to homeopathic treatment and this is your first place of hearing about it. My hope is to answer all of your questions. And I can be emailed at nicole@pureforceremedies.com or text me at +1 801 349 6785 if you have any additional questions that you have after this webinar. So let's get straight in. My intention is for you to leave here having a solid understanding of hopefully where you are. So as you're listening to this, I want you to think about all the people who are in your family, who are in your life. Think, does that relate to them? Or perhaps that is me. Obviously, to get a diagnosis of which miasms are active and dormant in your health and your family's health, it does require a practitioner. But as we're going through, I'm sure you're going to see yourself. And that's really the fun bit. So let's get straight into it. What is homeopathic medicine? Now, homeopathic medicine is both an art and a science, and it has a 200-year-old history. It started by a German physician called Samuel Hahnemann, who was disillusioned. He was a pharmacist and a physician at the time. And back in the days when they were using leeches and bloodletting and all kinds of crude substances for healing. It was a very brutal type of medicine. It was very much a hit and miss type of medicine that they were using at the time. And he was disillusioned because of the amount of deaths that they were having, because a lot of the measures were so extreme. So he started playing around with the idea of diluting the crude substances of illnesses or of the medicines to treat the illnesses, and in doing so realized that by diluting them down they became more powerful. And this was really the beginning of homeopathic medicine. So he started doing what we call provings. Now, provings are our historical bank. So it's over 200 years. It's books and books and books. Any of you who have visited me in my clinic know that I have books and books and books on the shelves of all of the provings. And this was the writings that were done 200 years ago and even up until now, which is our data collection. So a lot of people have a lot of skepticism. They have a lot of questions when it comes to homeopathy. And they say, well, where's the data? Well, the data is in these provings. So the way that the provings were done is Hahnemann would give the medicine in a diluted potency, and we'll talk about that in a moment. So say he started with arsenic amalgam, which is crude arsenic. He would dilute that down and he would succuss it. They would bang it on a Bible. And those of you who are patients of mine or have seen a homeopath before, you'll understand the process of water dosing and dry dosing and succussing bottles and all of that. It's a fun part of homeopathy as you learn more. And he would succuss these, therefore turning the arsenicum album medicine into her homeopathic medicine. So it would start as the crude substance of arsenic, and it would go through that process of dilution and succussion, and then he would give that to healthy individuals. So it wasn't just that he was administering it to the sick, he would administer it to healthy individuals, and the symptoms that they would produce in their body and their mind, in their physical feelings and their symptoms and the pathologies that would manifest became the beginning of his provings. And so the people who have really got the historics and understanding and where the data is found with homeopathy is actually with healthy individuals, not with sick individuals. Because what he realized is that the symptoms that he produced in a healthy patient when given the potentized homeopathic medicine were the same symptoms that were to be relieved and taken away from a patient who is ill. And so this was the beginning of the law of similars. So he began to realize that the medicine would produce in a healthy individual what it would take away in a sick individual. And this was the law of similars. So we prescribe remedies according to this law. And so we're always looking for a symptom totality. So whenever you speak to your homeopath, they'll say, okay, I need to take the case. and I need to get the full picture. So what are the mental symptoms? What are the emotional symptoms? What are the physical symptoms? And for those of you who are patients of homeopathy already, you know that the details matter. So it's not just, okay, I have an earache. What time did it start? Did you get it when you wake up? Is it better from cold or hot application? Do you feel better when you're inside or outside? Have you tried laying down? Has that made a difference? Which ear is it? Is it a throbbing pain? Is it a stabbing pain? And the reason we go for these details is because there's over 15 remedies that can be used for an earache. And we look to these provings that are stored in a book called the Materia Medica to get the most accurate remedy that is going to be the simillimum, and we apply it as per the law of similars. So those details matter, and he started to collect this data. And even now, globally, all around the world, there are provings being done all the time. Provings being done on new remedies, and we're discovering and expanding Materia Medica every year. My first experience of a proving was when I was at college, and it was a mandatory first year assignment, and we were given chamomilla. And so I had no symptoms, and within 25 minutes of taking the prescribed homeopathic remedy, which was chamomilla, on a healthy patient who had no symptoms, I started drooling and salivating and crying and having sore pain like I was a teething baby. At the same time, I had runny stool that looked like chopped egg and spinach. And you read then in the provings in the Materia Medica that that's exactly the symptom presentation that was collated by the healthy individuals 200 years back. That is therefore the Materia Medica, and it is the proving of chamomilla. So fortunately, we stopped. I stopped taking the medicine, and I therefore the proving had stopped at the same time. But I learned very quickly about the power of homeopathy. My first husband, which is Annika's dad, is a pharmacist, and he said to me one day, "There's no way that homeopathy works." And I said, "Well, would you like to do a proving?" And I gave him a proving of Nux vomica. And within 30 minutes, he had violent diarrhea. He was vomiting. He had a sweat. He was angry and irritable. And he was quite beside himself. And we completely repeated the dose until he said to me, "Okay, this stuff is real. Okay, this stuff is real." It's a really great way for people to learn about homeopathic medicines, is to do a proving. But if you're a homeopathic patient, you don't want to be proving your remedies. So therefore, the law of minimum dose and simillimum are really important, that your practitioner is actually prescribing according to that. So the law of minimum dose is that we give the smallest amount required to produce a remedy response in the individual. Because what a homeopathic medicine does is it activates the vital force that actually does the healing, rather than the medicine coming in and actually imposing itself on the individual. And this is why it's so easy for us to treat cattle. I treat sheep in my clinic. I treat budgerigars, cats, dogs, lambs, goats, herds of cows with mastitis. And the same laws of homeopathy are applied, and they work whether you're treating an animal or you're treating a human. And so the law of minimum dose is that you give only the amount of remedies to produce a remedy response. And then as the person gets better, or the animal gets better, you reduce the dosage out, because no longer is the vital force needing the activation from the remedy to actually create the healing and the balance. And so we're always looking for a remedy that we call the simillimum. So one of my cases today in my clinic was a raging fever, hot, delirious. The numbers were getting pretty high. We were concerned that there was going to be convulsions coming with the fever. But because the child was listless, delusional, it was really getting high into the numbers, the flushed face and the dilated pupils and the glassy eyes, that is the Materia Medica of belladonna. And so the belladonna is the simillimum that I gave for that fever. So I selected it according to the law of similars, in that I looked for the symptom presentation in my patient. I then matched it to the remedy that correctly responds in the Materia Medica, which was belladonna. And then I administer according to the law of dose. And in this case, I did water dosing of belladonna 30C. And within 5 doses, 15 minutes apart, the fever broke. And now the child is asleep and all is doing well. So these are the basics of learning about self-prescribing. They're the basics of homeopathic law. And they also give us all of the answers to the data. and to the fact that it's been working in clinics and in hospitals for over 200 years all over the world. And it's a reliable scientific method, but the art of applying homeopathic medicine can sometimes be delicate. So the next thing to understand is the progression of disease. And this is a really important part when it comes to miasmatic medicine, because chronic diseases arise as a result of a deep inner susceptibility or predisposition to certain types of illnesses. And this is the definition of what a miasm is. Now, homeopathic medicine is the only medicine that I know of on the planet that has the ability to work on your genetic predisposition. And that's why I get so excited about it, because it means that you do not have to become the medical statistics or the diagnosis or prognosis of your family history. So, for example, my father's family has a lot of degenerative arthritis. It has a lot of, all of my aunts and uncles have knobbly hands and fingers. They all suffer with a lot of joint pain. They're always worse in the winter. And so they've got a lot of syphilitic presentations of joint diseases. My mother, on the other hand, in her family line, she's actually the oldest and surviving member of her family, because everybody dies of heart disease in their 40s. So this becomes a really important thing for me, who's now getting closer to 40, that I'm working on the miasms that I have inherited genetically from my mother, while also trying to look at the ones that I accepted from my father. So this is an important piece to realize, that we don't have to become the medical statistics that potentially we've been told that we have. And this in itself is a big field of study within the Western medical world even. The last 15 years, there's a lot of discovery and a lot of research that's been done in this field of epigenetics. Now, epigenetics was the field that came out and said, yes, if you exercise and if you change your diet, you don't have to die of heart disease like your father did. And you don't have to have cancer, even if you have a predisposition, there may be an active gene to breast cancer. You've got more likely. However, what you put in your mouth and what you put on your plate and what you choose to think and feel and the activity you do in your life will make a difference. And this, for us as natural medicine passionate, people who follow natural medicine, for natural medicine practitioners, this was a really important, groundbreaking time for us, that this science and this research was being presented, because particularly as homeopaths, we've been banging this drum for 200 years, okay? Because we've seen in Kent's lesser writings and Hahnemann's journals and all of these old books from 200 years ago, we saw that he was doing miasmatic treatment. He was stopping these cycles of predisposition even back then. So it becomes interesting as to where it is that you sit. So before I share with you the 4 different miasms, I want to talk about how they are transferred. Now, miasms are the deep inner susceptibility to a certain group of illnesses or pathology. They can be both acquired and inherited. So I want you to think about if you have children, the health that you and your partner had when you conceived that child, because that it will be the miasmatic profile that child achieves. And this is why I'm so passionate about pre-pregnancy care for both the mum and the dad, because if we can get those miasms dormant instead of active, it makes a huge difference on the vitality and the vital force, and also the miasmatic presentations that are active or dormant when that baby is born. Similarly, every time that you experience or invest in a new sexual partner, you will take on their miasms. Now, how terrifying is that? Okay, so the way that works, and you may have even experienced this yourself, you may have seen this in other people, is as you start a new intimate relationship, you will start experiencing symptoms that belong to the other person. And you think, gosh, we're kind of in a little bit of sync. I never used to have migraines. I never used to have eczema. Okay, well, I've been really constipated, right? It normally takes about 3 or 4 months for these miasms to settle down, because you're exchanging this energetic piece. So miasms are both energetic and they are also cellular. So they are transmitted sexually. They are also transmitted through genetics in terms of birth. The other thing that can affect miasms is that you can have miasms that are active or that are dormant. And a good homeopath will be able to look at your medical history, look at your presenting symptoms, take a case, and then accurately be able to tell you, these are the ones that you have active, these are the ones that I think are dormant. And we have goals with this because we want to map the progression of the disease. So when it comes to miasms being active or dormant, it's very important because that's the only way that we ever achieve cure. If we have active miasms, there will always be active predisposition to pathology, which in the correct environment, such as poor lifestyle, glyphosates in our food, fluoride in our water, emotional stress and trauma, they therefore go rampant. And this is why one of the most telling phrases I have in my clinic for the last 17 years has been, you do not wake up one day with bowel cancer. Okay, there is an active miasm and it's a process of predisposition, and then it's just the perfect storm and the perfect ingredients over a long period of time where your body is trying to tell you things. So as we'll go through this and I talk about the main presenting symptoms in each of the miasms, I'd like you to look at it and go, well, that's what my body's been trying to tell me. I've had symptoms that are like that. Or, you know what, that sounds like my brother. Or, you know, my husband suffers like that. That's the pattern of his disease. And these things become very important in terms of the progression of disease, because my goal with every single one of my patients is to have them living in Sora. So you'll see that this is the miasmatic chart in front of you. You'll see that it's progression in terms of time. The birth section is on the left, the death is on the right. And my job with whenever I see a new patient is to work out whereabouts miasmatically the profile sits before I start treatment. If I'm not 100% sure of this, I have to dig deeper in my case taking, because I will always give several remedies as part of treatment. My first remedy selection is the person's constitutional. This is the idea in homeopathy that we have an essence. We have a remedy that is the most similar to us, it is the most similar. And when given to us, our vital force is activated and we are given the opportunity to heal itself, and that we respond quicker and faster to illnesses. And that constitution is something that we'll often have throughout times of our life, or throughout the whole transition of our life and the different seasons and as we age. The second remedy that I will always give as intercurrents is I'm treating active miasms and I'm trying to button them down. Okay, I talk about locking them down. I talk about buttoning them down with my patients. And the reason I want to do that is because my goal is to get everybody living in Sora, because Sora is a great place to be. Sora is where we hope to live most of our life, where our vital force and our immune system is working for us, so that no matter what illnesses or life challenges that we experience emotionally, or times of transition, people dying, divorce, moving house, loss of business, you know, life happens. And no matter what it is that would happen, if you live in Sora, you will be reactive, responsive, and you will overcome such things in your life and infections and illnesses without them sitting in there and getting stuck, and therefore creating long-term pathology. Because remember, miasms are all about chronic disease. So they start oftentimes in Sora. Now, it would be nice to think that when all of us had our babies, they were born in Sora, but that's not always the case. So I want you to think about, if you have children, perhaps you had some that were more thriving than others. Perhaps you had children that had recurrent ear infections, kids that were on antibiotics all the time, kids that had colic, whereas the other ones were completely fine. The other one of your children perhaps was a terrible teether or just never ever slept. Okay, so these are all symptoms of the miasms because they're not living in Sora. When they're in Sora, they're easy babies. Okay, and when they're born in Sora, and Sora is also locked down, okay, because we don't always want even an active soric miasm. We want it locked down so that then the person can be in true acute responsive reactive health. That's what my goal is with all of my patients. But as you acquire new sexual partners in your life, as you connect and you marry somebody and you start a family, as you experience trauma, things such as car accidents, change. For me, moving overseas from my practice in Mount Gambier, South Australia, moving over to Utah 4 years ago, and now here in Colorado, every life transitions, my divorce, things like that, all impacted me in the mind, and therefore then the body, because we are one organism. And I had different miasms that became active during those times. And as a result of that, I had to do miasmatic work. I had to do anti-miasmatic treatment to lock those down and push me all the way back to Sora. So it's always interesting to know when you're starting homeopathic treatment, as you continue wellness care with your homeopath, you ask them, where am I sitting with my miasms? Where did I start in my treatment? Where am I sitting now? And as a result of that, if something changes in your life, for example, if a sudden death of a loved one, or you had a move or divorce or a car accident, these life things and things that can be traumatic and cause a lot of upheaval can be enough for this miasmatic profile to shift and for one of these miasms to become active again. So Sora represents where we want to live and when the body is responding. But then as we get tired, as things start to get stuck, as more pathology starts to creep in, that can be as a result of poor lifestyle habits, overindulgence, drug layers, things like this, we slip down into psychosis. And psychosis is not mental psychosis, but it is the miasm that is all about sluggishness. It's about congestion. This is where period pain starts. This is where the beginning of overgrowth of tissue starts. So this is where we see cancer starts, the beginning of epithelial cells in the cervix for women, warts for children and adults, plantar warts, skin tags, moles that start changing, skin cancers, things like that. They begin in psychosis as things start to really, really slow down. And as a result of this sluggishness, we then see more toxicity build up. So toxicity in the liver and the gallbladder creates more systemic inflammation. Toxicity in the bowel, such as constipation, irritable bowel syndrome. All of those metabolic processes begin to slow down, and we start to get bogged. This is also the beginning of where depression lives, okay? So it might just be, I have bad days. It's not that I go to bed for days at a time. I just have bad days, or I just can't seem to snap myself out of it like the way that I used to. And so this slowing down of the body's response and its ability to heal itself is the real crux of what the psychotic miasm involves. When this is active, we can't metabolize and absorb food. We gain weight. We experience a lot of inflammatory diseases, and there's a lot of sluggishness of the mind. So symptoms just as easy as brain fog, or needing to be addicted to stimulants like caffeine and alcohol to be able to have a good, happy mood, or to be switched on and be able to not have brain fog and be able to concentrate. And these things can happen in babies, okay? You can have a 3-week-old baby who is constipated and who's not coping with their mum's milk, or not coping with the goat's milk or the dairy formula that they're given, and everything's slowing down and the metabolism's stuck and they don't sleep and they cry a lot, and they've got a lot of sluggishness and congestion in their lymphatics and in their bowel. So this psychotic miasm doesn't always mean later on in life. Any person of any age can be in any place with this chart. But as we get closer to this syphilitic miasm, our chronic disease, our ability to respond to disease is far more compromised, which is why death lives there. Because we're getting closer to the business end and the scary end of the body not being able to recover. Okay. And I'm going to talk about drug layers and things that influence miasms in a minute, but I just want to emphasize that these things can be fluid. Okay. They can be fluid and moving. And this is where constitutional and ongoing wellness care and building a relationship with a homeopath who does miasmatic work is really the essential piece here in preventing long-term chronic disease and getting on top of and reversing chronic disease. I have a lot of patients who come to me and say, I love Chinese medicine and acupuncture, and I love naturopathic medicine, and I've got a really good naturopath I've been seeing for 20 years, but they don't do miasmatic stuff. And so I feel like I'm never getting to the bottom of the stuff that is plaguing me. I have more wellness and I definitely have better quality of life, but I'm still not working on that biochemical cellular stuff because I'm still turning into my parents. I'm still holding the illnesses and the genetic predispositions of my parents. And this is where homeopathy will lock that down. It will move you into Sora, and you won't have to, and you will not experience those diseases if it's done correctly. So let's talk about then the tubercular miasm. So the tubercular miasm is when the body gets stuck in psychosis, but it then reaches out and it finds all of this adrenaline. A lot of the time it's cortisol. Okay, it's not true energy, it's cortisol, which is the stress hormone. Okay, and it's the adrenal overload, or it's a massive amount of coffee and alcohol, and overdoing the rich foods and and beverages and things like that. And we're reaching out, and the body's going, come on, get it together, right? It's this final last attempt to go, come on, I need my vital force to work, I need my body to get better. The problem is that it can't maintain it, so it gets very exhausted very quickly, which is where we see recurrent and reactive illnesses. And this is where a lot of the kids in my clinic sit. A lot of people come to me at treatment when they've got the active tubercular miasm because they have recurrent ear infections, or they just can't get off antibiotics. Or, you know what, it lasts 3 years. Every 2 weeks of winter, we have something that comes into the house and we are still sick 3 months later, or it takes 3 weeks for a cough to go. And this is because the body is tired. The vital force is tired in the tubercular miasm. And so therefore we have recurrent and reactive diseases. So I just want to talk through a few ailments and show you how they progress. So let's talk about tonsillitis. So tonsillitis will often start as a bacterium, which is in sora. It will then often only affects children and adults who are in the psychotic miasm, and then recurrent pustular tonsillitis, when they're then talking about taking the tonsils and adenoids out, they're living in the tubercular miasm. And that's often when I get the phone call, as in, we've got a date set for the ear, nose and throat specialist. I don't want to put my kid through a general anesthetic, but what can I do? So not only do I treat the similimum and a selective remedy according to the law of similars, which we've talked about, but I also lock down this tubercular miasm, and I work really hard to get them through psychosis and rising back into sora, so they don't have to go and have them taken out. Okay, let's talk about eczema for a minute. Eczema will always start in sora, where it's a biochemical, environmental issue to oftentimes chemicals or an allergic reaction, or to lying in the grass, things like this. So you'll start with an itch. That itch will then have a suppressant, a lot of times like a cortisone cream or a steroid put on top of it, which pushes it down into psychosis. And then they are reliant on the cortisone to have the clear skin or to manage the itch, because the vital force is so compromised and it's so sluggish that it actually can't heal itself. And then years and years later, they either stay in the psychotic miasm or they move through the tubercular, where it's now not only there all the time, but it's turned into psoriasis, and it's now cracking and bleeding. And it's now not just on my hands like a contact dermatitis, but it's now everywhere. Okay. And then unfortunately, as a result of treating something like that, you've got to take them through the tubercular miasm, down through psychosis, and rise them out into sora. And if there's a lot of suppressive drugs, particularly cortisones and steroids, we can have a 2 to 4 week window where I'm not very popular. And because what is in the body and what has been in that congestion in the psychotic miasm, all those drug layers, they come to the surface and they have to be expressed. So the skin can be very hot and angry for 2 to 4 weeks as we rise into sora. But as we rise and come out of sora, we never have eczema again because we live in sora, right? So this is how things progress. So it's not just, okay, well, I have eczema, so eczema lives in the psychotic miasm. It can sometimes be tubercular. Eczema can also be syphilitic if it's really infected, right? And it's creating gangrene. And I saw a lot of that, of chronic untreated ailments because of the poverty, when I worked and did my homeopathic postgrad in the hospital in Mumbai. So I worked in a homeopathic hospital over there. I got my postgrad. And this is when this stuff really, the rubber hits the road, because you're saving lives in a hospital with people who are in the syphilitic miasm. So let's talk about tubercular shifting into syphilitic. So as I talked about with the tubercular, when the body gets tired, the vital force gets tired. And so things start to slip as well. And this is when we start to see degeneration and deterioration of tissue. So rheumatoid arthritis, having to have knees replaced, a lot of neurological type diseases, so MS and Alzheimer's and Parkinson's disease and all of this kind of thing live in this syphilitic miasm, where things start to slide very quickly. And a lot of my elderly care in my practice is to lock down that syphilitic miasm, rise them up to tubercular where they have a quality of life. And sometimes because of their age, because of the drugs that they're on, that can actually be the only thing that I can achieve because they have lived in syphilitic miasm for so long. But my job is to lock that syphilitic miasm down and move them back towards the other way so that that deterioration doesn't continue. Women who cannot conceive are often in syphilitic miasm, and you think, goodness, they're of childbearing age, they should be healthy, they should be youthful, their vitality, but a lot of the time they've been on a lot of mental emotional antidepressants, things like that are very suppressive. At the same time, they've been on the pill for a long period of time, and so the body's ability to create its own cycle and then have estrogen based illnesses and endocrine disruptive type symptom pathology has them living in the syphilitic miasm, which is why baby's not coming. Okay, they can't conceive until we lock down the syphilitic miasm, we rise them up through tubercular where they start feeling a little bit more like themselves. Okay, we get the drugs out of their system and we start getting them onto some good clean eating so that their detox pathways are open. And then it's normally just between psychosis and tubercular where they'll conceive. And then there's a lot of work that needs to be done by a good qualified homeopath who knows what he or she is doing to keep that baby healthy and viable, because the miasmatic picture has been often so crazy, and it's been down in syphilis and in syphilitic. So just my final piece on this chart before we move on is just remembering that this does have a 200-year history. This was Hahnemann's research. He realized that it was a predisposition, it was an essence, it was almost a contagion that he was seeing. And when you read back to the Ken's lesser writings and Hahnemann's journals, he saw that a lot of these came from venereal diseases. So Sora was from scabies, it was from that contagious itch. Psychosis was from gonorrhea, tubercular was from tuberculosis, and syphilitic miasm came from syphilis. And when you think about it, all of our ancestors, regardless of our where we live in the world, our age, our race, no matter where it is that our ancestors lived, they all had bases in these contagious and often venereal diseases. And so this is where a lot of our pathology and chronic diseases have its roots. And so we are not treating syphilis, we're not treating tuberculosis, we're not treating scabies, but we are treating remedies that have similar actions and similar essence to what he saw 200 years ago. And this is why as homeopaths, we can stand on this research, we can stand on the cases and the very well documented cases of how Hahnemann did apply this and how he got all of his patients back to Sora. Okay, let's talk obstacles to cure. It's another really big part of miasmatic homeopathy and homeopathy in general. So a lot of people seek out homeopathic medicine because other things haven't worked, or they went to the herbalist, or they went to the acupuncturist and they did well for a time and then things stopped, or they were on the asthma protocols of the suppressant and the steroids, as well as the asthma puffer, and they've been on that for a long time, but now the asthma relief is not there, and the dosage is going higher and higher and higher. And what we see in homeopathy is that there are obstacles to cure. There are things that are in your environment, that are in your energy body, including trauma, drug layers, allergies, and food intolerances that are obstacles to your vital force being activated, which is what heals yourself. The remedies do not heal. The vital force, when activated, is what actually cures the individual or the organism. So as we take a case in homeopathy, it's really important that we are knowing all of these details of traumas. We know what drugs have been there and how much of those drugs have been there in their history. We know of any allergies, and that doesn't just include anaphylaxis, that also includes food intolerances. And that's oftentimes when a homeopath will ask you to take out something from your diet. It's not just that we're trying to get you to an alkaline plant-based diet, which is far more sustainable to getting you to live in Sora and thrive in Sora, but we will take them out to see if that is truly an obstacle to cure. It's something that the vital force cannot overcome in its low level of integrity right now. And most of the time that is because of active miasms. So you can have several active miasms at a time. So, and oftentimes Sora and tubercular will be active at the same time. Psychosis and tubercular can be active at the same time. And a good homeopath will treat all the way through with the correct anti-miasmatics and the correct intercurrents and constitutional to be able to take you back to Sora relatively gently so that we're locking down one at a time. However, I've had cases where I've not been able to penetrate with the constitutional, or I've not been able to penetrate with the anti-miasmatic medicine. And as a result of that, because of the obstacle to cure, it's not been until we've taken that out that we have had a remedy response based on being selected according to law of similars, law of minimum dose, and Smillerman, which we went through. So I'll say this is absolutely the remedy. I've done the work. The matrix looks good. The materia medica, all of that, the pieces are there. But because of one of these drug layers or the food intolerance, or there's a trauma layer that needs to be treated first before the miasmatic picture will start to actually resolve and respond to the homeopathic remedies. So whenever you are giving your case, or you are even giving your symptoms to a homeopath, if you can ever think about, well, you know what, last Tuesday we were running to at the back at the traffic lights and it really scared the boys, and that night they came on with the cold. That becomes really important to the homeopath, because we're not only going to treat the cold, which is the presenting symptoms, but we will treat the shock and the trauma layer from being in the car accident. Okay, so it doesn't become a permanent obstacle to cure. And what I see, unfortunately, more than not, is the long-term, the pill, oral contraceptive pill use, and even marinas that are being used now for female contraception. They are creating permanent obstacles to cure with the psychotic miasm. So oftentimes I'll need to take that into consideration. We'll actually take a break from the pill for a little while. We'll do the miasmatic work and then put the pill back in, if that's what's desired, or the marina. And then at least we're not dealing with the compound of the active miasm and the drug layer at the same time. Okay, so it can get pretty curly when it comes to these obstacles of cure, but I just wanted you to know that they do have an impact on the miasmatic profile. The next thing that's really important with miasms is never well since. So perhaps you had a traumatic childbirth yourself with one of your children. Perhaps you did have a traumatic birth and your mother had a traumatic birth with you. Vaccination layers, trauma, car accidents, and surgery. I have a case at the moment where a little girl was in ICU for 3 weeks with a really bad case of meningitis. And that is now showing up in her clinical miasmatic picture and her vital force response with constitutional and miasmatic treatment, even though now she's 6. Okay, so the trauma of that hospital visit and the drugs that were used and how traumatic she found that time in her life is now created a never well since that is impacting the miasmatic chart. So not only was she in psychosis, and then she's now, all these years later, she's now in syphilitic miasm, and I'm trying to get her back to Sora from all the way at the end. So she's been a very sick little girl. But we have these trauma pieces and we have a never well since with her hospital visit. So these things become very important because we are an energetic frequency. We are an energetic being. The vital force is vibrational. It's an energetic living breathing thing almost. And so as we strip the trauma out of the energy body, the miasms respond as a result. We can lock them down and we can move back to SOAR even quicker. So the work of a good homeopath is to work through these layers and, most importantly, eliminate suppression. So unfortunately, all the drugs on the market are suppressive. Unfortunately, some herbs can be suppressive. Some forms of counseling can be suppressive even when you're doing mental emotional cases. And again, these people don't know that they're doing suppressive stuff, but it can be enough that it keeps them bogged in one miasm. And so you've actually got to do these things. We've got to lift the layers out first before we unlock the miasm. We clear it out and then we lock it down again. So more than anything, we're always looking for elimination of suppression, because suppression takes us down towards the right-hand side of the chart, whereas we want to live in Sora, which is on the left-hand side. The other thing that we're looking for is Herring's Law of Cure. So Herring's Law of Cure says that we will heal from within to without and from top to bottom. And this is a really great law that we have to follow in homeopathic treatment. We need to be looking for this in every single time that you're talking to your homeopath. If you have symptoms that are going from top down, you know that there is suppression or the illness is progressing worse and the miasmatic picture is becoming more complicated. So whereas if it's going out, then we know that we are healing, we're eliminating suppression, we're getting closer to Sora. So I want to share with you one of my cases of chronic psoriasis. Psoriasis has been there for at least 40 years. He came to me presenting in his 50s. He can't remember not having psoriasis. He's got it all over his body. It's red, dry, and scaly. It drives him crazy. He's embarrassed by it, but it's just what he's always had. It's all through his scalp, behind his ears. It's all down his legs. It's on his chest. It's in his elbows. It's everywhere. He's tried every drug on the market. He's tried every cream on the market, and now he's fed up. So he reaches out for homeopathic medicine. Well, my job is to find out where he is miasmatically, which is in syphilitic miasms. So we've got a lot of work to do, okay? I give him his constitutional, so we get the constitutional lift. His body's starting to heal itself because the vital force is activated and things start chugging along. So not only does the redness and the angriness and the scaliness and the itching completely resolve within the first 5 weeks of treatment, but then we start seeing it move according to Herring's Law of Cure. So no longer is he up in the night and driving his wife crazy with scales in the bed, but we're starting to see it disappear from his toes all the way up to his head. He's now got the tiniest bit left on his head and behind his right ear and a little bit just underneath his lip. And this has been a case that's taken several months, but Herring's Law of Cure has shown me that the case is moving in the right direction. We've done the miasmatic work. We've had to lock down syphilis. We've then had to lock down tuberculosis. We've then had to lock down psychosis. We're now in Sora. We've got the last little bit left, and we know that as it's leaving the head, Herring's Law of Cure tells us it's never going to come back again. So this is another really exciting thing about homeopathy is you can get permanent cure if you follow these laws. And a good homeopath knows these laws, but it's a good homeopathic patient also knows these laws because he or she knows when things are going in the wrong direction. So whenever you see something going down, you go, okay, there's something amiss here. Okay, things are getting more complicated, more miasms are implicated, and so therefore more anti-miasmatic and more constitutional work is needed because we want it coming out through our head. Okay, so similarly, not just with skin cases, even with things such as mild fevers and earaches, I'm always saying which ear is affected. Is it the bottom or the top of the ear? Is there a headache? Is it the base of the headache or is it just at the top? Because we want to see it moving out all the time out of the top of the crown of the head. So that's Herring's Law. Okay, so what's the process of getting started? Well, basically, you find yourself a good homeopath. You find somebody who does miasmatic homeopathy. You find somebody who understands what the progression of disease is, and then you also start working on your diet, okay? A homeopath's job is to do this miasmatic work, not yours, because we have a lot of hours and hundreds and hundreds and hundreds of cases that need to be under our belt before we can really start doing this with any kind of confidence and with any kind of real permanent result. I say to my patients, I really didn't get miasmatic homeopathy and the power of it until probably year 9. I'm now 17 years into it. I got the theory at college, but it takes hundreds and hundreds of cases of seeing things go one way on the chart and then the other way on the chart, and then seeing the up and the down with Herring's law of cure to realize what it is that you need to do, and the stages of the remedy and the frequencies and the potency changes. It's a very delicate science. But at the same time, I'm now going to talk about what you can do, because the miasm work and the homeopathy is the job of the homeopath, but your job is to simplify. So miasms respond better and they shift quicker with the active homeopathic medicines when you simplify your body. When you think about your body as a computer, okay, it can only handle and break down things that are carbohydrates, proteins, and lipids, okay? Fats, proteins, and carbs, and which are sugars. Anything outside of that, the computer gets bogged, it doesn't know what it's doing, and it goes, error message, and it stores it either as fat or toxin in tissues, which creates biochemical change, creates acidic environment, begins a process of inflammation. So as you're doing this constitutional, anti-miasmatic, this deep preventative work with your homeopath, simplify what you put in your body. Open your detox pathways. If you haven't listened to my detoxification webinar, I really encourage you to do that. If you need to get a hold of it, just reach out to me. Otherwise, it is pinned in my Mindful Mums of Healthy Kids Facebook group. And all of my webinars are pinned there in the files notes. The reason you want to simplify is the more detox pathways that you have open and the less error message and the less load of toxicity and therefore inflammation that you have, the quicker you will transition into SORA, which is the goal. If you continue to eat complex carbohydrates, you continue to have soda and lots of alcohol, and you're still having a lot of glyphosate toxicity, and wheat and gluten and dairy and chemically processed skincare and all of these things, your body as a computer is already overloaded, which means that your homeopath can't use the vitality that's in and the elasticity and the vital force with the remedies to create change quickly. So I always ask my patients to adopt a 80-20 plant-based diet when possible, to eliminate glyphosates, to eliminate additional toxins, family, skincare, cleaning products, go through your home, get read up about endocrine inhibitors and phthalates and propylene glycol and all of the nasties that live in our cupboards until we consciously transition over. The other thing is water. Getting rid of fluoride in your water is a really big one too, in terms of simplifying the energy and the systems and what needs to be calibrated and processed and metabolized and understood and absorbed from the body's computer every day. The simpler that is, the quicker you will get back to SORA with your homeopath. Food is medicine. And when we eat a plant-based diet that is alkaline, we activate the mitochondria. The mitochondria is in every single one of our cells, and it's the energy center. So when we activate the mitochondria by having the plant-based food and not having the chemicals and the toxins from the glyphosate and the fluoride and all those other poisons that we just mentioned, your body's active mitochondria and all of the cells get busy activating your vital force. You feel better, you have clearer skin, your eyes are clearer, you have less brain fog, you wake up feeling more refreshed. So you can already start to do this every single day and activating that mitochondria, because that's activating and pushing the vital force to heal itself. The better that your cells can be in equilibrium and balance, the better they will respond to the homeopathic medicines. And so there's this beautiful synergistic relationship between the energy that's in your body and the energy that the homeopathic medicines are trying to create for your body. And so activating the mitochondria through having an 80-20 plant-based diet is really beneficial. So the acid alkaline, that's what you put into Google. In a lot of my chronic cases, my chronic disease management, where there's a lot of inflammation, a lot of deterioration, where they're tubercular and syphilitic, I will also implement 100% plant-based diet. I will often do a raw food diet. I will also prescribe mono meals. And this is where the discussion with your homeopath, the case taking will say, do I need to do that? Okay, where am I sitting on the miasmatic chart? What are the goals? Why am I coming to see you? This is what I need changed in my life. I don't want to feel like this anymore. And so a homeopath, a good, versed homeopath in nutritional medicine and will actually give you empowering things to do like that and say, right, open your detox pathways. Let's do 4 days of mono meals. Okay. Mono meals are where you choose one fruit or vegetable and you just eat nothing but that for 4 days. Why? Because it simplifies the computer system. It gives us a nice 4-day window to really slap that miasm around, lock it down, and have you shift out through the other ones. So this is where this synergistic relationship and the long-term relationship with your practitioner will help you understand where you're sitting with your health all the time. And that's a very empowering thing. When we live in a Western world now where 1 in every 2 people, that's almost every marriage statistically, will die of cancer in this lifetime. So not only do I do this because I want to be around for my children, but I advocate and I educate my patients like this because I want you to be doing this work for your children and cleaning up their miasmatic profiles now so they don't have to experience what you're experiencing and have the fear and the concern that you have in your 40s, in your 50s, in your 60s, to have to fight those diseases. Because if we lock these miasms down when they're children and we manage them throughout their life, apart from trauma or transition and change and big life type events that are very unsettling, most of the time those miasms will stay locked down. They'll stay dormant, which means they can't generate pathology. And that's really where the magic lies with this constitutional and this anti-miasmatic care is we do not want these miasms active so they cannot generate pathology. So it's the same thing with pathology in the body, that cancer, inflammation cannot live in an alkaline environment. A lot of my patients like to do urine tests or even saliva tests every morning when they wake up with the little strips to say, where am I sitting? Because they have a really concrete goal when they come to me and they say, I do not want to become a medical statistic. I don't want to be in pain, overweight, and grumpy like my mother. So what can I do now? And so the plant-based diet, the raw food, in severe cases, water fasting, and I have a really aggressive but life-changing liver gallbladder detox that I use in my clinic. These are the things that I use in my arsenal that I have, as I said, 17 years, that I use in my arsenal to get my patients to live and stay and thrive in Sora. So hopefully this has given you a really good grounding. I'm now going to open this up for questions. If you would like to get in touch with me, you can get in touch with me through my email, nicole@pureforceremedies.com, or my cell number is there. I'm in Colorado, so you'll need to add a 1 if you're outside of the US. You can also book a free 20-minute discovery call with me through my website, speakwithnicole.com, if you have any questions. So let's open this up for questions and I'll see you in the chat box. Okay. Can you be in more than one miasm at a time? Yes, you can. When you have more than one miasm active, you have a lot of conflicting pathology. And more than anything, you just feel like you've been run over by a truck all the time. So a lot of people who wake up every day, who feel exhausted, who can't get themselves out of bed, who wake unrefreshed, people who live with chronic pain, people who struggle to concentrate, who rely on stimulants, that's often one of the symptoms of having more than one active miasm at a time. But oftentimes, if they do, they'll also have pathology. They'll have diagnosis already. And that's when they'll come to me and they'll say, okay, I've been diagnosed with this, I've been offered this, I'm worried about this, because things are starting to show up by that time. If you have one miasm that's active, there'll be one little niggly thing, or often it might even just be seasonal. I'll just get hay fever every year and it just wipes me out. Or, you know what, I can only tolerate dairy in a small amount because otherwise I get irritable bowel syndrome. So one miasm will only kind of give you small little snippets of ailments. But if you have 2 or more, you feel it and you know it. So any other questions? I'm just going to unmute. Is there any other questions at all?
No, brilliant. Everything was answered, and yeah, looking forward to showing this to my husband as well, so he gets a better idea of what he's signing up for.
Sure. And why the details matter, right?
Yeah, totally.
Because the more information that we have, the more that we can understand. I've given you very much the snippets view of the overview and what it can do, that you can just get so bogged down in the detail. And really, as a patient, you don't want to get into that detail. You need to provide that information to your practitioner, and they do that analysis.
Yeah, brilliant. I'm excited. Thank you. You're
welcome. Any other questions at all? Okay, great. Well, thank you for joining me. I really hope this has been valuable. This webinar will be as a recording for you to reach for at any point in time. So hopefully you got something out of it, and thanks for joining me.
Yep. Thank you. Thank you.